Good afternoon, everyone. Thanks a lot for joining us today. And I'm your host, Sahar once again, and I am having Mark Lawson with us today. Like you already know him very well from the conference, he is a board certified oncology pharmacist, and he has been working at multiple hospitals, and currently he's working in Michigan. And we will be talking a lot about that today as well. So before that, I would like to mention that this session will be recorded to be shared on social media, and there will be a Q&A session towards the end. So if you have any questions, please feel free to raise your hands at that time, or you can post those questions in the chat box right now. But up until then, please keep your audios and videos turned off. Now coming back to Mark, how are you doing today?
I'm great. How about yourself?
I'm doing great as well. Thanks for asking. Just before starting this session, I actually was thinking about the conference. That it already has been, 1 year when we last met. It was March 7th, and today is March 6th. So officially end of 1 year.
Wow.
Yeah. And there has been so many changes since then. At that time we were planning on the conference, and there was a news that there are 2 or 3 coronavirus cases reported in the Fort Bend County, and we were at that point we were scared that we should even go for the conference or not, and what will happen if people will show up or not. And we were super duper scared, and we were analyzing and assessing the situation that we should go for it or we should just cancel. But then we decided to go for it with all the necessary measurements. And then but right now I was thinking that today, if we will, wake up and have a news that, there are only 2 or 3 cases in Texas, just in the Fort Bend County, people would be out and partying, right? So
yeah,
a lot has changed, literally. But I don't want to get completely off the topic, and I will come back to the actual topic, or the conversation topic for the conversation today, by asking you, Mark. You recently moved to Michigan. And I would really like to know, first of all, that did you find any difference in Texas and Michigan in terms of work culture?
I would say Texas is definitely more progressive as far as work culture for pharmacists. Like, there's a lot of hospitals here in Michigan, either they don't have an oncology specialist or they don't really know what to do with their oncology specialist. And even if you look at like the major, probably the best practice here, at least for oncology pharmacy, is University of Michigan. They're very robust, and they've got a lot of good collaborative practice agreements and things in place. But our other biggest player, the Karmanos Cancer Center, who's tied into where I work, they're still not there the way like you would see at MD Anderson or some of those other places. Like, they're still trying to hire people that do what I do right now, whereas MD Anderson's had people in my kind of a role for quite some years now. So yeah, I mean, outside of that, it's kind of pharmacy's pharmacy, but the Michigan's, I think, a little bit behind as far as when it comes to collaborative practice agreements and being more progressive. At least in oncology. We did have an ID pharmacist at the hospital that I work at now. And so, it's going in that direction here, just like it is down there.
I understand that. And I think if we compare, we have such a great medical center here, so
yes,
we should actually be expecting that anyways. I think many states, if we explore that, it should be about same, except the major ones, right? So that's
right.
actually understandable. But I would really like to know more about your current role, because I remember you telling me about the billing codes and stuff. It looks different from what we do here, even in the hospital. It's very much different. So I would really like to know more about it.
Yeah, so it's super cool. If anybody in Texas likes cold weather, come on up to Michigan. We don't actually have any openings right now. But the name of my program is called POEM, and it's about oncology pharmacists optimizing patient outcomes and medications. And the underpinning goal of it is to demonstrate the difference that having a pharmacist embedded in the clinic can make in patient care and preventing patients from going into the emergency rooms and helping them to manage their therapies. And really, this program launched in the internal medicine realm. And so there were some internal medicine pharmacists, and they kind of work in a collaborative with, for us, the Michigan Oncology Quality Consortium is one of our partners, and that's MOQC. And then our other partner is Blue Cross Blue Shield of Michigan. And so Blue Cross Blue Shield of Michigan saw the impact that an internal medicine pharmacist could make if they were embedded in that primary care practice, with managing insulin, titrating blood pressure meds, following up on patients, and basically running that show. And so when Blue Cross Blue Shield saw that value, then they were open to doing it for oncology. And so this oncology initiative, the POEM initiative that I'm part of, there were 3 of us, 3 different sites, and 3 very different sites. And the Blue Cross Blue Shield was so confident that we could have good financial impacts on, like, even just keeping their patients out of the emergency rooms or whatever, that they, in order to get us placed, Moxie and Blue Cross and MICMT, which is another Michigan affiliate that was kind of more tied to the internal medicine piece, Blue Cross Blue Shield was willing to pay my entire salary for the first year just so that I would be in that practice. And then the practice also got benefits, that they got to participate in some value-based care perks. So if the practice has got the stamp on it that they're participating in value-based care, basically they get increased revenue every time, like, they do anything. Like, if one of the oncologists sees a patient, they get so much revenue for that each visit. And if they're participating in value-based care, they get more. And so the practice is like, sweet, we get to make more money. Oncology pharmacies, like, awesome. We get to engage with the practice. Blue Cross Blue Shield's like, great. We get to save all this money. Our patients will stay out of the ER. They'll stay compliant. They'll have better outcomes. The pharmacist will manage side effects. And so, it all kind of looked really good. And then what else can I say about the role? So the way that I justify my position, like, so the first year Blue Cross pays 100%, the second year they pay 60 to 70%. I can't remember what the number is. And then the last year they were going to pay like 20%. And then they just assume that the practice will take on my salary after that, based on 2 things: me billing for office visits. So I see the patients in an office visit setting, just like an oncologist or, another provider would. And then the other one was doing a quality assurance project, which would show we reduced ER admissions in capecitabine patients by 10%. And, before that, Blue Cross Blue Shield was paying however many $1 million for ER admissions per year. And after that, it dropped to, whatever. And as far as the billing piece goes, so in this state, the main payer, there's not as much of a mix of payers in Michigan. So Michigan's main payer is Blue Cross Blue Shield of Michigan, because the auto industry is pretty big up here, and they just kind of, like, I guess, over time have gotten a little bit of a monopoly up here. And so because they partner with Moxie and MICMT, it made the project possible. Like, if I was doing it in Texas, because of the payer mix in Texas, there's too many different payers. So, like, when I do something, there's only 2 payers that'll actually pay for my codes. They're called, the codes I use are called team-based care codes. And in theory, anyone on the medical team can bill these codes. So, like, if I had a financial navigator that was helping my patient to get free dasatinib or whatever drug, they could actually bill for the 2 hours it took them to enroll that patient into that free drug program. So it's not just me, like, it's a team of us billing these team-based care codes. And then each code has next to it who can bill for that. So, like, some of them, it doesn't have me, like an end-of-life conversation, it doesn't have a pharmacist next to that one. It has like a physician assistant and a nurse. But what it demonstrates is that you're coordinating patient care, you're ensuring continuity of care, and it's kind of goodwill on behalf of the insurance company. like, hey, we know you're spending a lot of time that you could be doing other things to get free drug for this patient or to coordinate their DME or whatever it is. So for me, if I see them for an office visit, I can bill. There's a G code that I can bill, but they're all called PDCM codes. But my one that I bill for my office visit starts with a G, and it's like G9007. And then I bill one of those if I see them for 45 minutes or less. And if it's more than 45 minutes, I bill two. And I think, the two payers, Blue Cross Blue Shield of Michigan and Priority Health, that pay for those team-based care codes, I think they pay like maybe $60 per unit or something. So it's not like I'm totally making my salary in a day just by doing that. Mm-hmm. But in my practice, there's a lot of turnover and an oncologist left. And so they need somebody to fill in that gap. And so I'm kind of functioning in a dual role where I'm just like kind of ensuring the patients have a continuity of care. And it's not always going to get paid for every time I do it because some of the payers aren't paying for it. And if the oncologist saw them, they would certainly make more, they could bill for more money than me, but it's kind of a win-win for the practice with them being short-staffed. And then also like up to this point, my focus is on oral chemo. And up until I joined my practice, like nobody had even a list of all the patients on oral chemo. Like they didn't know who was on what. They just knew that someone was on something if they're coming in for an office visit. So if you're on, Bosulif or whatever, you come back for your office visit every month and then every 4 months. And that's all that they knew about those patients. And then they would call if they needed a refill. Well, now I've got a spreadsheet of everybody. I know where everybody's at. I know what their assistance is. And then I share that with the practice. And so it's just like, tracking these patients because they're really high touch patients. Like, some of them have like that I've followed up with have like 10 or more episodes of diarrhea in a day. So we have to give them Imodium. We have to sometimes dose reduce them, but I get to manage all that. And that is kind of cool, kind of a neat part about my role.
It's very interesting. And it looks very similar to, like I already said, it looks very similar to chronic care management. That's from Medicare, but
right.
It looks more comprehensive. And I think it's purely dedicated, you said, to oncology, or is it for other specialties too?
Yeah, so right now mine's just dedicated to oncology. And like I said, we do have those internal medicine pharmacists that are doing the same exact thing as me, but they've been in place for a while now. But yeah, I do just oncology. And then like, if you look at my collaborative practice agreement that I'm working to get placed, it's not in place yet, but some of the other sites have the same agreement in place. It kind of, you can have a general collaborative practice agreement, which just says the pharmacist is going to do what they think is necessary to take care of the patients within their scope, and they'll collaborate with the doctor. Or you can have a really detailed one that says, like, if somebody starts on Piqray, if their blood sugar gets above such and such, the pharmacist will implement the metformin protocol, and then the metformin protocol is spelled out, and then the provider knows ahead of time exactly what I'm going to do. Versus in the general one, the provider's like, okay, we're just trusting Mark to do this based on what he knows. And so you have to find that kind of that balance or that sweet spot. So in a way, it's not just me managing oncology itself. Like if Piqray causes diabetes and, other oral chemo drugs cause other weird side effects. And so like I would manage those, whether it's, rash or hand and foot syndrome or whatever. So I do step outside of oncology as far as managing other components of their health.
Definitely, because with oncology, it's like if a patient is a cancer patient, there are so many other things involved as well because of the side effects of the medications itself. So definitely, it's not limited to oncology only. But I was just asking in general, like you already said, the internal medicine also is involved, and that, like, for example, if there's a practice specifically for nephrology, they will not be covering that one, right? They are just covering oncology or internal medicine, and in the oncology component there are several other things involved, like you said already, but specifically for any other specialty they do not cover it, right?
No, not right now. I think
Right
eventually we'll get there, but it's not yet. They probably should have, an infectious disease pharmacist, and a nephrology would be good, but they're not quite there yet.
Right, right. But I can definitely foresee that it is such an important component of the whole healthcare system, and I'm sure patients and healthcare systems and even insurance companies, they are getting much benefit out of it, less hospitalizations and other stuff like that. But moving forward to the next question, Mark, I know that you have nutrition degree as well, right? So
Yes.
yeah. So did that help you at any place in your career path as a pharmacist, or what do you recommend any other pharmacist out there? Should they go out and get the nutrition degree as well, or is it helpful just for specifically for pharmacists?
That's kind of a tough one. I guess it did help me out for for anyone who's dealt with TPNs and managing patients, like nutrition support type stuff. Like I actually wanted to go into nutrition support for a long time, and then it turned out that there just weren't a lot of jobs. I don't know how it looks now. I haven't seen any jobs in that area for a long time, and I think BPS may have even done away with that specialty. They used to have a certification exam you could take to get board certified in nutrition support, just like in oncology.
Mhm.
So I wanted to do that for a while, but then it didn't seem like the market was there, and I liked oncology, so I switched gears. But as far as it helping pharmacy, yes, in a way, I've learned a lot of good stuff about human anatomy, and nutrition plays a huge role when you really look at the overall picture of, when you're treating somebody with cancer. I mean, there's even, how do I want to say it? I listened to a really amazing lecture, actually two amazing lectures from two different people about how the microbiome in your gut impacts how you respond to chemotherapy. So like some of the microbes in your gut will, like, the chemo's everywhere. Is when you get a, toxic chemotherapy infusion, it's in your blood, it's in your secretions and stuff. And so the bacteria in your gut end up getting exposed to that. And depending what the microflora in your gut are, you may respond differently. So if you have a really lousy, like, American diet and you're eating burgers and Cokes all the time, your microbes are not as strong and there's not as many of them. And so they might like not metabolize the chemo that makes it into your GI tract. And then that increases that toxicity for that person. So I like knowing it from that standpoint, just because like human health is all tied together, and a lot of what we eat, like there's a lot of new, if you look at the medical schools now, I've even toyed with the idea of going back to medical school a few times. If you look at them now, they all have actually a health meets food type requirement to graduate, where you have to go into a lab and cook using like whole foods, like from a garden, like squash and mushrooms and all that good stuff, and like showing patients the impact that nutrition can have on their overall health. So from that standpoint, like I love nutrition. I wouldn't say it helped me get any of the jobs that I've had, but then it also is kind of something good to fall back on. Like now, if I want to look and do something else, like there's a lot of opportunities I think out there for like health coaches. I've seen a few pharmacists that have jumped off the Walgreens bandwagon and decided to be professional like health coaches. And so they exercise, they eat right, and then they bring people into that fold and, teach them how to do that and how to make changes in their lives. So I do like it as kind of like having it for a backup. I think there's a lot of, especially in the way things are right now, I think there's a lot of need for people with nutritional knowledge, but, it doesn't help me specifically in my pharmacy career because, traditionally we treat people after they're sick. Pharmacists don't focus on wellness, and, hopefully as the profession moves forward, we'll have more of a focus on wellness and keeping people off meds instead of just being a friendly person that dishes out lots of meds to them.
Definitely. And you are absolutely right. And I think there is another emerging fields while you were talking, I just came into my mind that another emerging field is nutrigenomics after pharmacogenomics thing, where they, check your genes to see how you respond to different food elements. And I think that will be soon, I think, incorporated in such areas as well, along with the, the way you were saying about the micronutrients for the gut, how it affects. And I think, yes, it is something that is needed to be incorporated, because it's related to prevention as well. So even before you start having an issue, you are basically preventing it by managing the diet plan and your micronutrients and avoiding the toxicity, like you said. So definitely, and thanks a lot for explaining it in a lot of detail. But the next question I would like to ask is similar to the nutrition degree that you have. You also have an EPIC, certification. So did that help you in your career? How did you get it? And uh, especially with the job that you are doing right now, is it also applicable over there? And how did it help you?
Yeah, so getting informatics certifications or credentials is really good right now. And I think it's really important. And I think a lot of pharmacists are going to need to go into that area, or that there's a need for pharmacists in that area. For me, so with Epic, you can do a couple of different things. You can get Epic certified, which means you take a trip to Wisconsin. I think you may have to go up there a couple times to their headquarters in Wisconsin and do all kinds of training and know coding and all that other stuff. And I actually almost did that. Like I was right at the cusp of doing that, and then I just decided not to. So my certification is a super user. And so basically what I did was and the way I got it was I was lucky enough to be there when our company was implementing a new EMR, which was Epic Beacon. And so because I was there and I was a pharmacist at that site, an oncology pharmacist, they gave me that chance to take the class that I needed to be a super user, which just meant I went around and trained everybody else how to do what they needed to do to make the workflow in the clinic work. And when we had problems with the computer dropping charges, I would deal with those and interface with the revenue cycle people. And so I think informatics is huge in pharmacy, and you see a lot of people out there getting into data mining and getting the data to show outcomes and do a lot of research. And that's just, it's the field's only going to expand. So if you know computers and you know how to analyze data, or at least interpret the data that's analyzed by the computer gurus that pull it for you, that's all the better for you, in your career. And I've seen a few oncology pharmacists. There's one her name's Kelly Karlstrom, and she's on LinkedIn with, and I follow her, and she was an oncology pharmacist dealing with Cerner and helping with builds in Cerner, which is what I have now. I have Cerner, so my Epic stuff actually doesn't do me that much good, even though you can still kind of apply some of those same concepts, whether, whichever EMR you're working in. But Kelly's out in California working with Project Ronin, or Ronin, however you pronounce it. It's RONIN. And that's informatics based. So they're trying to create these really great informatics platforms for cancer treatment centers and oncology offices, where basically the computer's kind of like smart, right? Like the computer, I walk in there and I have whatever kind of cancer with such and such mutations. And then that computer system is smart enough to be like, hey, Mark, you should really do this trial that they're doing in Massachusetts. Or it like pulls a lot of real-time data to help direct patients on the best place to go. Because if you look back to the archaic times when we just had paper charts, the oncologist writes something in there, they do something, the patient goes home, they assume they're getting the best care. Versus if you really look at how connected we are now and what EMRs are going to be capable of doing in the future, that EMR could like tell you everything that you need to get the right treatment or the best treatment for that patient, even though they're not seeing all those different doctors and they don't know that those other trials exist.
That's very interesting and a very vast area. Thanks a lot for answering that question as well, Mark. I see that you have worked in a lot of hospitals. So how you were so lucky, or you can say what really helped you in switching your jobs and working in different hospitals? That's quite inspiring. And I think many people would like to know, is it the experience that you already had in one hospital? Did that help in the next one? Or how it really worked out for you?
Yeah, it really worked out for me for a couple of reasons. I got out of pharmacy school right at the time when not as many people were requiring a residency. So like when I got out of pharmacy school, I worked in a retail store, and then I jumped after like 1 to 2 years in this community pharmacy. Actually, no, the first year I did pediatrics, and I was in a big pediatric hospital in Kansas City. Then I did retail for 2 years, and like they still weren't requiring residencies. And so because I had that pediatrics, they hired me at Texas Children's Hospital to do pediatric oncology, like without a residency of just having had the experience. So, you know, a lot of it was, you know, I came at the right time, I got out at the right time. And then for a while, like I was doing what nobody else wanted to do. Like everybody was scared to do pediatric oncology. So like when I went to MD Anderson, all the oncology, most of the oncology pharmacists there were like, Mark, you need to go to pediatric oncology. You know, we don't want to deal with that. And so I dealt with stuff that maybe other people weren't as interested in dealing with. And for, you know, luckily I was. And then, you know, some of it, a lot of it really was riding on pediatric experience because I worked in a neonatal ICU. And again, they hired me because I had peds experience. And at that time, there were not many pharmacists that had pediatric pharmacist experience. So I was in that kind of groove or that niche. And then, you know, you could argue maybe I shouldn't have changed jobs quite as many times as I have. You know, I've taken a lot of different jobs over the years, sometimes for increased pay, sometimes for more interesting roles or whatever. But for me, it's kind of more about being open to trying new things. And if someone offers something that, you know, that I'm kind of always open to try that. And so I've made some changes just because I want to see what else is out there and, you know, try new things, I guess, more than anything.
Right, right. I actually did another interview with Julie Montiel, and she was saying about same thing. And she actually had a career path like in which she was actually switching to different roles, completely different, like MSL and then research, and then you know in the university she was a professor as well. So she was saying exactly same thing, that you should be open to accepting anything that is in front of you, you know, instead of just analyzing that, you know, it's not right for me, or you should be open basically to any opportunity that is coming, and then you'll make your own way. And that's awesome. And actually I think you did it's also about the fact that you did the right thing at the right time,
Yeah.
uh, when nobody else was doing it. So I think that was a very like a plus point for you, and that's why you progressed so well. That's awesome. So I know that a lot of since we are already talking about the, you know, going to different hospitals, I know a lot of foreign pharmacists that we have. I think many of the participants that we have today here as well, they are foreign graduates as well. So they are struggling with you know, this thing that they are not able to get into the hospitals easily. So do you think there is any scope, because you have already worked in so many hospitals, you might already know that, did you see any foreign pharmacists working over there? And if they came in, how do you think that helped them, or what should their plan be in order to land a foot inside a hospital?
Yeah, I would say to get inside of a hospital, you have to do a lot of networking. So I know a guy from Iran that works at Houston, West Houston Medical Center at the HCA hospital there. His name's Lawson, and he did a lot of the same things actually that I think you did, right? He like worked really hard and he found some kind of he found an internship, but he was way out. Like, how far was that away? It was at least like 40 or so minutes outside of Houston, and he would go there and do all his intern hours. And then luckily, at least at that time, the culture at West Houston Medical Center was very geared towards wanting to bring in international team members. Like I was the only kind of like normal, if you want to call it normal. I was the only like American in that pharmacy, and everybody else was from India, Nigeria, wherever else, you know, the Middle East.
Well, I didn't know it happened like that at some point as well.
Yeah.
We
So
always thought it in the other way, you know, other way around, that they always
yeah,
workers are
I
part
love
of it.
West Houston. So you gotta network and find those sweet spots. Cause like if you look at Memorial Hermann, they probably have some garbage in their human resources policy that says you have to have the American Pharmacy Association stamp on you, even though you know, may have learned more in Iraq or, you know, wherever you came from. Um, so, you know, sometimes finding the smaller hospitals is how you get your foot in the door. Sometimes you could do it through a staffing agency where you work somewhere and they're like, wow, we really like how this person works. And it's a smaller hospital and they hire you on. I interviewed when I was a director up in Texarkana at Christus Health up there. I interviewed, you know, whoever applied, And then I would go sit down with HR and talk to them about finding ways around those requirements. But you've got to have somebody that's going to advocate for that. And, really you can only get that through networking.
Definitely. So networking is the one point, and the second point is to start from some smaller hospital than the bigger ones. And once you have the experience, then it's easier to get the other one, the bigger one. That's
Right.
definitely a very good advice. And one question: what do you think? I mean, it's not related to the job itself, but what do you think how COVID-19 situation, the corona, this pandemic situation has impacted the job market of pharmacists? Do you think it was a positive thing for pharmacists or a negative? It had a negative impact.
I don't think it was negative. I'll say that much. Now, I think we've all seen some of the news where they're saying that women were really starting to get good footing in the market, and then all of a sudden all these women are bowing out because they have to be home and taking care of their kids with COVID. So like there were a lot of vacancies created by women having to go home and help their kids with school or whatever they were needing to do. So I would say there were some vacancies there, which shook things up a little bit, which created some new openings and opportunities, hopefully for some new grads to step in and get jobs, especially those new grads that have been, kind of waiting for a job to come up. As outside of that, I guess our cancer center that I've been working in Michigan did slow down quite a bit.
Mhm.
And that's a symptom of, for us to get patients have to get screened for cancer. And with COVID, people weren't going and getting their colonoscopies. They weren't going and getting screened because they're like trying to stay home and stay safe. So we definitely had a lull, but I haven't seen that with that lull, it's kind of been offset, at least in the oncology pharmacy space, with all these new MSL jobs opening up. Like for oncology, at least there's like new drugs coming out every week. There's a bunch of new CAR T therapies that are on the horizon. And so for oncology pharmacists, at least, even if our centers did slow down, I don't think I know anybody that lost their job for that. Plus, I think, a lot of my colleagues that I know migrated into MSL roles as well, supporting those new chemotherapy drugs that those big drug companies have.
Yeah, and I think also pharmacists are playing a great role in the vaccine administration as well. And while they were companies were while they were researching about the vaccines, and there were a lot of job openings that were coming in for the pharmacists that were remote, I believe, where they have to monitor everything and answer physicians' questions, patients' questions, any clinical questions that they had, for particularly for vaccines. That they were doing research on. So I think that also created new jobs for pharmacists because of COVID, right?
Yeah, I agree with that. And then, if you're a pharmacist that can give immunizations, we've all seen those ads out there where they're, offering to pay a pharmacist $120 an hour or whatever it is to give vaccines, which I'm not sure that I know anybody that was able to land a job like that, but at least you can make $50 an hour on the weekends going to, or wherever they're giving COVID injections, and do those injections yourself. I know, like at our facility, we were trying to set all of our employees up with their vaccines, and our pharmacist jumped right on board. Like our pharmacy director was giving shots, our pharmacy operations manager was giving shots. And unfortunately, I've never been trained in giving immunizations, so I didn't get to jump into that. But and it's good for students too. I don't know if you saw anything down there in Texas, but my first COVID vaccine was given to me at Walgreens by somebody who was like, I think they're in their third year of pharmacy school. So I think it was cool to see that, like she was so excited that she could give me my COVID vaccine. I'm like, that's really cool. You're only halfway through your professional year and you're giving shots. Like, that's really awesome. So I think it gave some good opportunities for growth for a lot of people.
Definitely. And a lot of pharmacists that were like completely jobless, even if they have to have, even if they got the chance to get something which was on a contract basis or as needed for, vaccine administration, I think it was something good to start with, right? So I think it was a great opportunity. But I think even then, pharmacist job market is not really going very up. I think it's still declining. We still have the percentage that we expect in next 10 years for the pharmacist job. I think it's still not very good. So what do you think can really help pharmacists, overall, you know, to overcome this issue of the declining pharmacist job market? What is your suggestion? Because that the thing that you told about the BCBS starting this thing, I think that was definitely one of the things that can help, because it's creating basically a new job, because they were paying a pharmacist, right? Like they were paying you. So what do you think other options can be that can actually help in overcoming this situation, or you can say creating more jobs for pharmacists?
Yeah, I mean, it's good. The answer is what I'm doing, but the challenge is, proving that value to whichever company you want to prove it to, so you can get a job with them, whether it's the payers or whomever. Pharmacists need to step out from, while the product is always important and the pharmacist's job exists to get the products to the patients, like we're going to have to step beyond that and demonstrate value one way or another. And typically the best way we can do that is by demonstrating savings, which, like I was saying, with my role, you show that you're keeping patients out of the emergency room, or you show that you're preventing them from having to come in for expensive office visits because you're controlling their diarrhea before they get dehydrated or their nausea or whatever it is. But you've got to find those ways to save money. I mean, even when I was at like for oncology and probably for a lot of other medicine, they're going to be going into a value-based care system. And so if we as pharmacists can show how we can demonstrate value, like there was a dose banding initiative for some of the really expensive immunotherapies in oncology that we looked at Texas Oncology, that was going to save payers like millions if we implemented that. And if pharmacists can find those situations where they can impact financially what the payers are paying and also pull those burdens off the patients, like I think that's the sweet spot for us. And not only that, but that's kind of like the right thing to do. So like if you're a diabetes pharmacist and you're like, hey, some of these diabetes meds are awfully expensive, maybe we could just manage this person with metformin. Or, these are all really expensive. Yes, I'm a pharmacist, I know a lot about medicine, but like I'm going to sit down with this person and do like a full nutritional thing with them, and then demonstrate to the payer that, hey, this patient sat down with a diabetes pharmacist, and not only is the diabetes pharmacist dishing out the right meds and giving the right counseling about those meds, but they're also helping that patient to even maybe reverse their diabetes, but through nutritional counseling. So I think pharmacists should have, if we want to stay marketable, hopefully we would have, multiple skill sets and things we can either fall back on, or as well, things we can use to, increase the demonstration of the value that we're adding, outside of just getting the drug to the patient. Like what else can you add to that to save money?
Definitely. And I think this whole system is such an interesting system, because if a clinician is providing best care to a patient, number one, patient is getting that benefit because the patient is healthier, and patient is not going to hospital and ERs. Secondly, the clinician, they are happy because they are healthier patients, and their reimbursements get higher because their patients are not getting admitted to hospital again and again. And then overall, the insurance companies, they are also happy because their patients are not getting admitted to hospital, so they don't have to spend that much on them. So I think it is a very interesting concept where this is literally like a win-win for every person out there.
Exactly.
We just need to put more light on it and incorporate more pharmacists into this structure, where they can, show that how valuable they can be to the whole system. But thanks a lot, Mark, for answering all the questions, in detail and patiently. One last question is that, is there any advice that you would like to give other pharmacists that are, out there looking for jobs, and even with the jobs, is there any advice that you would like to give them?
Advice on looking for jobs?
Mhm.
Well, I would just say do the same thing, some of the same things I've done. I mean, there's some things I've done that I'm not sure I would recommend doing now. Like now, if you're in a job, I'm not sure I would look to change necessarily. I mean, unless you see some like great benefit or great new kind of unusual opportunity. Um, so I would say if you have a job, try to make the best of that job that you have, given how tight the market is, and don't really, if you can, don't restrict yourself. I think I may have said this at our summit last year as well. Like, if you're like, oh, I don't want to live anywheres but except for Houston, and you may not be able to find a job. I mean, Houston's really tight right now from what I've seen and what I know. So you may have to live in, Beaumont or some like lesser area. So I would definitely say that. I would say look at non-traditional roles. There's a lot of good MSL jobs out there that people can apply for and might even be more enjoyable than counting tablets at, Walgreens or mixing IVs at MD Anderson or whatever. So I would definitely encourage people that are looking for jobs to, look at those kind of things where they're kind of non-traditional opportunities. Don't be afraid to go back. Like if you can't find a job, maybe there's some residency or some like obscure fellowship or something you can find, but always try to find ways to like better yourself. Seattle Genetics and some CGen and some of those other companies have fellowships for industry. So like if you just got a pharmacy school and you're like, shoot, I can't find a job, you were a good student, you have good, a good resume, go look at it in one of those industry fellowships, and you go to Seattle Genetics and spend 1 year doing a fellowship, and like they'll prep you during that fellowship and you'll be ready to be an MSL like right out of the gate. Versus somebody like me, like if I wanted to go be an MSL right now, that would be a little more challenging for me because I don't have that industry experience. I've even looked at a few MSL roles and they're all like, oh, well, we already have all these applicants that are already in MSL. And so we're going to hire them instead because that's kind of a unique skill set. So thinking outside the box really is going to be the biggest thing. To walk out of pharmacy school and think, okay, I'm going to go count tablets at Walgreens and make lots of money for the rest of my life is kind of, that's kind of gone by the wayside. And then even like be willing to work for less pay, or, if you can find volunteer opportunities. And then, like I said earlier, networking is kind of, you have to network right now because everybody's getting so many resumes shoved in front of them for every job that for your resume to even get seen for anybody who applies to that job is tough, let alone, if you're coming from a university in another country. I think, that obviously adds an extra layer to that as well. So yeah, I would say those things, geography, patience, non-traditional roles, and then maybe even being open to doing something else. Like maybe you're like, okay, pharmacy, I thought was going to be cool, but maybe a physician's assistant would be better for me. And you're still bringing that pharmacist skill set to the table, whether you go off and be a physician's assistant or, whatever it is. But don't box yourself in. That would be my biggest thing that I would say to people.
Definitely. And I think it's a very, very good advice. Thank you so much, Mark, for answering all the questions once again. And now I will start taking questions. I already see 2-3 questions in the chat box, but everyone, if you have any questions, please feel free to raise your hands and I will ask you to turn on your video if you want to come on video. Otherwise, I have a few questions here. So the first one is from Shaman Bhak, and the question is, what are your 3 best advice for career advancement?
The best advice for career advancement?
3 best advice.
Sorry, can you say that one more time?
3 best, like 3 best advices, like 1, 2, and 3. What are your 3 best advice?
Oh, okay.
For career advancement?
So the first one that I'm going to say is, pharmacists, typically when you look at pharmacists and pharmacy directors and managers and stuff, like a lot of them just end up in those roles because they've been a pharmacist for a long time. And I would say that some of those people that have ended up in those roles in that manner are not really doing the best job that could be done in that role. And so I would say, definitely study emotional intelligence, which there's a whole book about emotional intelligence out there. I think it's called Emotional Intelligence 2.0, but find some of those good books. Brene Brown, and she's a speaker there in Houston and does TED Talks. So Brene Brown does really great talks. The Emotional Intelligence books by Travis Bradberry. Like, there's a lot of good psychology related things out there that teach you how to build teams and how to navigate, how to deal with a difficult person, how to deal with unusual situations at work. But those skills are timeless. So if you become a good manager and you learn those management skills, who knows, you might end up being a manager of at UPS or Chick-fil-A or something, because they want, the world wants people that are good with people, that know people skills. And so pharmacists, at least in my mind, we are not good necessarily at people skills when we come out of school. We might be okay at it, but school doesn't teach us that. It teaches us to memorize a bunch of drug names and diseases, and we have all that memorized in our brains, and we want to be a little pharmacist and live in our box of our comfort zone and not go deal with difficult people or do human resource related things. So that's my first one. The second one is stepping outside of your comfort zone. So maybe, your comfort zone is to have a certain work day every day. You don't want to work any harder than that. Well, maybe stepping outside of your comfort zone means you take on an additional project that's going to help nursing. It may not even really be related to pharmacy, but it'll help the nursing team. And so you partner up with the nurse manager at your facility to work on whatever it is that they need help with. And then that'll, when there is a leadership position that opens up, chances are nursing is going to be involved in making that decision as to whether you get promoted, if you're going to be over a big department or whatever. And so they'll give good, recommendations. And then the third one is building relationships as best you can at your job, so that you have those people that can give good recommendations, but also that you have a good relationship with somebody that can mentor you at the job, like another leader that can mentor you, that can be honest with you and assess you and say, you can come to them and say, hey, this situation happened. This is how I dealt with this difficult patient or this difficult person. What do you think? And that mentor, that leader is kind of like, they may not be your best buddy because they're your boss or whatever, but they are willing to give you uncensored feedback. I think we all need somebody in our life, especially in our professional life, that's willing to give us uncensored feedback. And, even for me, if someone brought me into their office and said, Mark, that was really horrible, that could have been done better, that, also that I'm open to being like, oh, I probably did mess that up. What can I do to make it better? And be receptive to that feedback. Because a lot of pharmacists, we're kind of overachievers or whatever, and we're not used to being wrong. We always want to be right all the time. So we study and we memorize all these drugs and all the diseases, and we always want to be right. That's our control freak tendency. And so be willing to be wrong and learn from that and grow, as a person connecting with other people within the profession.
Yeah, thank you so much, Mark, for answering this question. And then another question is that nutrition support certification from ASHP, would it be beneficial in oncology also?
Right now, I can't remember the last time I saw a nutrition support pharmacist working in any of the places that I've been in. They have pharmacies that are dishing out TPNs because it's good revenue. Once you get somebody on a TPN, they almost never come off of it. And then you've got CAPS that's making TPNs for hospitals. So if you want to look at TPNs and that's your thing, then I think it's not a bad idea. If in oncology now, if you want to do something other than get your BCOP, you need to go to ASHP, and there's a course in ASHP that I've been meaning to take myself, that you get. I don't know if you get a certificate or what you get out of it, but it's revenue cycle management. And a lot of hospital systems have very broken revenue cycle management systems where they're losing money hand over fist, especially 340B hospital. I'm in a 340B hospital right now, and they're dishing out all these expensive IV iron preparations and things. And like, you go talk to the claims department, and they don't even know if they're getting paid for these things. And the money's going out like a sieve. And so, you know, oncology is at this point, you know, it's one of the highest, it probably is the highest dollar expenditure, and there's the most room there for pharmacists to have impact. And there are revenue cycle pharmacists. And like my role as the oral oncology pharmacist, those kind of roles are only going to continue to expand. And so if you can get your oncology certification, or even just get a job at any specialty pharmacy and then just ask to work in the oncology department, like, that's crucial, because getting those drugs to patients is at least half, if not more, of the work. Like me to, you know, I go and prescribe some Sprycel, that's one thing, but it takes a lot more work and a lot of people behind the scenes to get that into the patient's hands. And so there's definitely a lot of opportunity there in oncology. So I wouldn't say don't do nutrition support, but I wouldn't say that I see very many jobs for it. And like, if I was hiring an oncology pharmacist, like, that's not the need that my patients have right now. Most of the need that they have is just to get the drugs in their hands, and then hopefully have them on oral therapies, you know, at home, so they don't have to come to the infusion center.
Right. Like Tina is also mentioning in the chat box that since she's helping in opening the she's actually opening with in the partnership with another company, the cancer center. So she's also saying that we are looking at using nutrition support pharmacists as a consultant at our oncology centers. So I think that can definitely help there, but it really depends if they are looking for the nutrition, or a pharmacist role that has some value for the nutrition part. So I think these are two different sides. Pharmacists can definitely go into the nutrition side, but at the same time, if you are looking for a pharmacist only, probably nutrition will not help as much, right?
Yeah, I mean, you know, with my nutrition degree, or anybody that gets any kind of nutrition certification or degree, like, I can definitely help those patients. I can be like, yeah, you should have 100 grams of protein every day. Yes, you need to eat more fresh fruits and vegetables. You know, I can do those things and make those recommendations, but I don't need a certification to do it. But if you're cancer, I mean, if the cancer center's platform, part of the way they're making money is by putting patients on TPNs, then that's a different story, right? I mean, I don't know that there's a lot of money in TPNs for cancer centers. They tend to make a lot more money on, like, if they dispense one bottle of Sprycel, they're making usually more money than they would make on several TPNs. But that doesn't mean that TPNs aren't lucrative or not, or that they, you know, obviously they still help some patients. Like, some people need that. So it depends. I mean, I just haven't seen much in my areas where I've worked, but it is, you know, it's viable. You know, there's obviously some market out there for it, and others probably may be more familiar with that than I am.
I think it depends on company to company or hospital to hospital, what they are really looking for, or what their requirements are. So we have another person who raised the hand, Noah Hare. Noah, I'm asking you to start your video if you want to come on video, or if you just want to ask the question in the audio, however you like. Please, you are the next.
Hi, Sahar, and hi, Mark. Thank you so much for always hosting these helpful events. And thank you, Mark, for all your valuable information.
Sure.
I am Dunya, by the way. I was just using my nickname for the account. I'm sorry about that.
No problem at all.
Mark, you caught my attention when you said we need to think outside the box. And I have a question. Being a foreign grad, what advice do you have for me in terms of looking for opportunities for internship in this somewhat crowded and congested market that we have right now? Thank you.
Yeah, I mean, as far as looking for internships, you just have to be, it's still going to pretty much boil down to networking and knowing which pharmacies are open to that. And usually the ones that are most open to hosting interns are the ones that want free labor, or the ones that have kind of a sweet spot in in their heart for, helping people that need help. I just saw one posted on LinkedIn the other day for a guy that moved down from, I'm not sure. Well, he's probably pretty happy about it. He moved from Canada down to Miami, Florida, and he was trying to do an internship somewhere in Florida, but he was a Canadian pharmacist and he only had a bachelor's degree. He was about my age. So, sometimes you just have to, put yourself out there. And I would say it is pretty, how do I want to say it? You have to be pretty bold or aggressive about, you could just say, hey, go into a small pharmacy and just kind of go in there and, buy something and look around, see what the lay of the land is and see if it seems like a good place that you could do your internship. And then you could just say to the owner, hey, can I buy you a coffee and we can talk about something? And then maybe they'll be open to it, or maybe you just go right up to them and start talking to them about it. But I think, the days of submitting a resume and waiting for someone to respond to your resume are kind of, like I said several times already, are kind of going by the wayside. If I was in a leadership position and I was in charge of everything, I would definitely be doing everything I could to help facilitate internships. That's not what the role that I'm in right now allows me to do, but, stay in touch. And if I end up in another leadership role somewhere back down there in Houston again, I'll definitely be looking to try to help that. Cause I definitely appreciate the foreign pharmacy graduates, especially trying to get over that hump when they get to the US and they have to do the internships and everything.
Right. Thank you so much.
Sure.
Okay, so this was the last question, and I believe we do not have any other questions. No. So thank you so much, Mark, for a very informative session. And thank you everyone who joined us today. This would not have been possible without the support of you all. So I will see you all next time. And up until then, please stay safe and have a nice rest of the day.
Thanks a lot. Have a good day.
Have a nice day. Bye-bye.